Welcome to the Tricare Prime Remote, and Active Duty Family Member Prime Remote briefing. My name is Kelly Parsons, and I'm the Seattle Battalion Soldier and Family Assistance Program Manager. Today's agenda is we're going to talk about what is Tricare, Tricare Prime coverage, Tricare benefit information, and other important information about Tricare. Tricare is a healthcare program provided for active duty service members, family members, National Guard and Reserve members, and retirees. It is a network of civilian and military healthcare providers to perform and provide preventative and everyday living healthcare. With Tricare, you are covered under the Affordable Care Act. The Affordable Care Act, you are required to maintain minimum essential coverage. Minimum essential coverage is what Tricare gives you, and you must have it effective 2014. In 2015, the IRS will verify based on DEER's eligibility that you have minimum essential coverage, thus you will avoid a penalty on your taxes. These are the Tricare regions covered by the different Tricare regions, which there are 3 of. There is Tricare North, Tricare South, and Tricare West. Tricare West is managed by United Healthcare Military and Veterans, which is, from this point on, your regional care manager or your regional provider. Everything starts with DEERS. DEERS is the Defense Eligibility Enrollment System that tells Tricare you are or are not eligible. You must keep your Tricare up to date. By keeping your Tricare up to date, it gives you multiple eligibility systems. The SFA can change your battalion SFA, can change your address upon arrival to your battalion. This will allow you to change your region when you report to your battalion. Not doing so could result in some pretty hefty medical bills. It's very important that you change your region for you and your family. DEERS will also tell Tricare if you are eligible for Prime Remote, or if your active duty family members are eligible for Prime or Prime Remote. Tricare Prime is a managed care option, meaning most of your care will be provided by a primary care manager. Specialty care will be referred out to a network provider under the Tricare managed system. Excuse me. Tricare eligibility, Tricare Prime benefits include active duty service members, retirees, National Guard and Reserve members on active duty for 30 days or more, and all active duty service members. With Tricare Prime, you are prohibited from seeing other providers without a referral other than your primary care manager. Tricare Prime Remote is the program that allows you, as a geographically dispersed soldier, such as most of our recruiters, to receive care from a civilian provider in your local area. This civilian provider will be a network provider who has signed a contract with Tricare. To be eligible for Tricare Prime Remote, active duty service members must work and live more than 50 miles from a military treatment facility, or exceed a 1-hour drive time. So in your dense populations, such as Los Angeles, Seattle, Salt Lake City, the 1-hour drive time comes into play. That way, if it's 30 miles and it takes you 2 hours to get to your military treatment facility, there's quite a bit of time involved in that, so you would be eligible for Tricare Prime Remote. To remain eligible for Tricare Prime Remote once enrolled, active duty family members must remain living with their sponsors, and there's only 2 exceptions to this rule. They are if the sponsor receives non-concurrent travel of family members or a hardship tour out of where they're living, the spouse and family members may remain at the same address. If they move across town, they become automatically ineligible for Tricare Prime Remote. The address must remain the same. National Guard and Reserve that are called to active duty for more than 30 days, and their duty location is more than 50 miles from a military treatment facility, are also eligible for Tricare Prime Remote. With Tricare Prime Remote, you choose or will be assigned a PCM. If there is not a network provider, a Tricare assigned contract network provider, you will be assigned a provider that is authorized by Tricare anyway. That way you're not penalized for there not being a provider in the area. Tricare Prime Remote options, that option is very similar to Tricare Prime, but is available to active duty service members living in remote areas. Tricare Prime Remote for active duty family members, they are eligible. They must register in Tricare Prime Remote. It is required for service members, but not for their active duty family members. They have other options, and that would be Tricare Standard. And we'll get into the benefits and the pros and cons of Tricare Standard later. Enrollment is required for beneficiaries to receive care from an authorized provider, thus resulting in fewer bills and the service member not having to file their own claims. Non-network providers can require the service member to file their own claims and submit their own referral paperwork. There are no annual enrollment fees for Tricare Prime Remote active duty service members or their family members. You may be eligible for Tricare Prime or Tricare Prime Remote active duty family member if you are or work and live more than 50 miles away from a military treatment facility, an active duty family member who lives with the Tricare Prime Remote enrolled sponsor, or you're a transitional survivor and or a National Guard and Reserve member called to active duty for more than 30 days. You must complete and submit an enrollment form for Tricare Prime enrollment, Tricare Prime disenrollment, and primary care manager change form. This will get you enrolled in Tricare Prime Remote. For active duty service members, coverage is effective the day the form is received by the regional contractor, which on the West Coast case would be United Healthcare Military and Veterans. For active duty family members, the 20th of the month rule applies. An example of that would be if you enroll in Tricare Prime Remote and you're an active duty service family member, if they receive the form on the 21st of April, you would not receive care until the 1st of June. You would skip the month of May. If they have the form on the 19th of April, you would receive effective coverage on the 1st of May. So you have to be careful with the dates so there's not a lapse in coverage. Tricare Prime and Tricare Prime Remote active duty family members, enrollees will receive most of their care from a primary care manager. The primary care manager provides preventative services, routine care for illnesses, injuries, and coordinates urgent care and manages referrals for specialty care. If more than one network PCM is available, you get to choose which one you want to use. I always recommend to my soldiers and the family members that they talk to other soldiers and family members in their own recruiting center to find out which provider they want to use. I can provide them a list of available providers, but I don't know those providers personally, and they may have a preference as to male or female or a general practitioner versus a family practitioner. So I always recommend they talk to their family members. The other option for our remote soldiers and their families, for specifically our remote family members, all soldiers that are more than 50 miles away from a military installation must enroll in Tricare Prime Remote. However, their family members have the option, instead of Tricare Prime Remote for active duty family members, they may enroll in Tricare Standard. Tricare Standard is the option for active duty family members, retired service members, and their families. survivors, and certain former spouses. Tricare Standard offers beneficiaries the freedom to seek care from providers outside of the Tricare network and may cost extra than using the Tricare Extra option, which goes with Tricare Standard. Tricare Standard gives active duty family members the option to pick whatever provider they want to go to. They do not require referrals for specialty care, but there is cost involved for both types of providers. No enrollment or enrollment fees are required for Tricare Standard. The other option available in very select and very limited areas for family members is U.S. Family Health Plan. Active duty service members may not enroll in U.S. Family Health Plan. U.S. Family Health Plan is a Tricare Prime option, and it does require enrollment. You must enroll through the Tricare or U.S. Family Health Network, and the 20th of the month rule does apply. You are assigned a Tricare Prime primary care manager, and they handle all of their referrals, all of their pharmacies are in-house, their labs are in-house. Everything is done by your primary care manager's office. It makes it very easy for the family member. There's no bouncing around from place to place for x-rays, lab results, that sort of, and then long waits for pharmacies. It's all done internal. So it gives family members a very easy option and less costly than Tricare Standard for the family members. There is still co-pays involved, just as there would be Tricare Prime. For example, for referral care for family members, you pay the $12 copay and the pharmacy copays, which have changed, and we'll go into those in a future slide. A program that some of you may not be aware of that's relatively new to the Tricare system is Tricare Young Adult. Many of us have children that are over 21 years of age, or 23 if they're currently enrolled in school, but they haven't reached 26 years old yet. For those children, Tricare has come up with a program to provide them medical insurance, and it's called the Tricare Young Adult Program. Normally, if you have a family member that turns 21 and they are not enrolled in school, their eligibility ends effective the 21st birthday. If they're enrolled in school and can provide full proof that they're a full-time student, and the sponsor provides 50% or more of their care, then they are eligible for Tricare Prime, Tricare Standard until their 23rd birthday. Effective their 23rd birthday, they are eligible for Tricare Young Adult. There are some conditions. They must not be eligible for federal health insurance or a health insurance program through their employer. If they are, they become ineligible for Tricare Young Adult. There is a fee for Tricare Young Adult, and I would suggest that you go to mytricare.com as those change, and you would be able to look up and download the enrollment forms on that site. That's mytricare.com. For routine care, there are three types of care as far as Tricare is concerned. There's routine care, four types: routine care, specialty care, urgent care, and emergent care. Routine care is general office visits, treatment of chronic or acute illnesses and diseases, and follow-up for ongoing medical conditions. Routine care also includes preventative care, preventative services to keep you and your family healthy. Your primary care manager will build a file on you and ask certain questions so they know your medical status and you can maintain care. Active duty service members always require referral for any civilian care, including clinical preventative services, mental health care, and specialty care. Your battalion SFA has access to the system and can look up if that referral is approved for you, what it's approved for, and where it's approved for. It takes approximately 10 to 12 days to get that referral in the mail from Tricare. Specialty care Primary care managers coordinate with your care contractor, your regional contractor, and in our case, United Healthcare. For active duty service members, the regional contract refers all referrals to Great Lakes for review to see if you're fit for active duty or if you're eligible to remain on active duty. This is not the case for referrals for active duty family members. They go directly to United Healthcare. The closest military treatment facility has first right of refusal on all referrals. Normally, if you are more than 50 miles away and you are enrolled in Tricare Prime Remote, the local military treatment facility will return that referral back out to a civilian provider for specialty care. Sometimes they will maintain right of refusal and request that you come to the military treatment facility for care. Depending on, and some of them do not know the drive time distances. So if you live 35 or 40 miles away from a military treatment facility and it takes you 2 hours in Seattle traffic to get there, that referral can be returned back out to the civilian community. And once again, your battalion SFA can help you with that through their patient advocacy representative or through United Healthcare. The point of service option for family members is another option that gives you the freedom to choose the provider you prefer. You can go to any provider out there for non-emergency care, but you're going to pay. There is a deductible for individuals of $300 a year and $600 for family members. The cost of point of service care is 50% of the Tricare allowable charge if you're seeing a network provider. Cost share for the patients in care is 50% of the allowable charge after the deductibles are met. So until you reach that 300 or that 600 deductibles, you're going to pay 100% of your care until those deductibles are met, and they are an annual deductible. Point of service care does not apply to active duty service members, newborn or adopted children during the first 60 days after birth or adoption, emergency care, clinical preventative care, and the first 8 outpatient mental health visits. It applies to every other category. Urgent and emergent care. In emergency, call 911. If life or limb is at stake, go to the nearest emergency room. Urgent care must be coordinated with your primary care manager. Prior to going to multi-care urgent care, Franciscan urgent care, whoever your local urgent care is provided by, you need to call your primary care manager's office. But in most cases, they're not open. So go to the urgent care, tell them you are covered by Tricare. They will call their 24-hour Tricare line for an authorization number. But it doesn't end there. You still, on the next business day, must call your primary care manager and ask for a referral for that urgent care visit. Some primary care managers will tell you that they do not provide backdated referrals. In urgent care instances, they do, as long as you call them within 48 hours and tell them what you went or your family member went to urgent care for. If you don't call, and this is the case in most of the bills that I see or the claims that are denied that I see, and in most of the explanation of benefits that I read for my service members and their families, they're billed point of service because there was not a referral put in the system by their primary care manager for that urgent care visit. So the service member is billed point of service and they wind up paying 50% of that bill. Sometimes we can get those turned around, but it's not always that easy. For mental health care, active duty service members must have a referral for any active duty mental health care on or off post. If you're going on care, there's on post, there are several types of mental health care. There's command directed. Of course, no referral is necessary. but your primary care manager needs to refer you if they want you seen by a mental health professional on post. If you choose to go off post, you have several options. Military One Source is an option, but Tricare is the best option for both active duty service members and their family. You may call the 1-888-978-9378 Tricare line, and they're going to ask on that recording if this is a mental health crisis. If it is, hit the star key. Somebody will answer immediately and get you the name of a provider in your area that can see you. You will have an appointment within 24 hours for a mental health issue if you call the Tricare line. Family members may obtain the first 8 visits without a referral. Please use a network provider. That way you won't incur any costs. And then after those 8 visits, if you're using a network provider, they can submit a referral for continued care for you. So you can continue seeing the first provider that you use instead of switching in the middle. Inpatient care for both active duty and active duty service members will always require prior coordination and a prior approval. The Tricare Pharmacy program that most of our remote soldiers use, they would go to a local pharmacy, an express pharmacy in their geographical area. There is co-pays, and they have just gone up for a Tricare retail pharmacy, which Walgreens is not. Walgreens has dropped out of the network, and you will pay point of service, which is 50% of your prescription. There are basically 3 Tricare pharmacy options. Tricare Retail Network Pharmacy, you can get up to a 30-day supply of your prescription. For generics is $8, brand name is $20, and non-formulary is $47. Non-formulary is a prescription drug that the pharmacy doesn't normally carry and they have to order it in. Tricare Pharmacy Home Delivery, which if you get registered in the program, is great. They set up for automatic renewals. You get a 90-day supply at no cost, and it's mailed right to your home. If you have a brand name prescription, it's $16 copay and $46 for non-formulary. But you get a 90-day supply versus the 30-day supply. Tricare would prefer that you use the home delivery service. It cuts down on costs for them as well as you. The military treatment facility, you can get up to a 90-day supply of non-narcotic, non-controlled substance prescriptions at no cost for generic or brand name. And depending on the size of the military treatment facility pharmacy, they may carry some non-formulary prescriptions, and those would also be at no cost to you. Get my slide to change here. Non-network pharmacies, the patient will pay 50% cost share on all prescriptions after your point of service deductible is met. The point of service $300 for individual, $600 for family members must be met before Tricare picks up their 50% of that prescription. For example, if you go to Walmart and you have a $100 prescription and you have nothing against your copay, your cost share for the point of service option, you're going to pay for 100% of that $100 prescription. If you've met your deductible, you'll pay $50 and Tricare will pay $50 of that prescription. Tricare Dental Program, they have several programs available, and the first one is the Active Duty Dental Program. It is exactly what it says, for active duty service members only, and for those that are assigned to geographical area, dispersed areas, mainly your Tricare Prime remote recruiters. This program is administered by United Concordia. They are not assigned a specific dentist. They can pick their dentist, but they must be a United Concordia network provider. Once again, I advise my recruiters to check with the other recruiters in their station, because they'll tell you who has been giving them billing problems, who hasn't been getting prior authorizations, who they've been having to pay bills because of. And you'll get your best care and pay the least amount out of your pocket that way. The Tricare Dental Program is available to active duty service members, family members, National Guard and Reserves, and their survivors. This is the program that is administered by MetLife. This is the program that your service member pays for out of their check every month. It shows up on their LES. And you must also use a network provider. There is another Tricare Dental program. It is for Tricare retirees. It is the TRDP. For more information on that, you can log on to mytricare.com and it'll give you the rates. The rates for that program are based solely on zip code and the number of family members that you enroll in the program. If you go to mytricare.com or uhcmilitarywest.com and build your account, there's multiple self-service options on there. You can, most of the time, make appointments, look at your explanation of benefits, file or check on a claim, check on your referrals and authorizations to see if they're approved, and find a doctor. If you want to find a specialist on your own, maybe one of your friends have told you about a great specialist in the area and you want to see if they're a network provider, you can look them up on either one of those websites. Here's a list of information and assistance from your regional contractors for Tricare West Region, which is the western 21 states. It is United Healthcare Military and Veterans. www.uhcmilitarywest.com. And it's always easier to go on the website than it is to call them, because then you have to manage the telephone system, which is not easy. During this briefing, I'm also going to touch on the Exceptional Family Member Program. It is a program for active duty family members with special needs. There's a lot of misconception about this program and how it can hinder a soldier to get promoted. It can hinder a soldier going certain locations, and in some instances it can. There are several programs available, and it opens a network of programs for active duty family members with special needs. The Exceptional Family Member requires enrollment, and you enroll through your specific branch, and your SFA can help you with that enrollment. It opens the door for ECHO Extended Care Health Option, ECHO Home Health Care Option, and ECHO Respite Care Option. The key functions of the Exceptional Family Member Program are assignment coordination, mandatory enrollment, and it considers family member needs during assignment. If you have a family member that has a special need, USREC is going to look at that. They get a flag when you come down on assignment orders. They get a flag that tells them this service member has an active duty family member with special needs. They look at those special needs. They have an EFMP coordinator at USREC that looks at those special needs, and they look at where they want to send you. They contact the nearest military treatment facility, which tells them, it provides them with information in the area that you're going to be assigned. So they know if the specialist and the specialty care that your family member needs, or that you as a family member need, is available in that area. We're not going to take a soldier and drop him in an area that doesn't have the care that his family needs. This is going to distract from the soldiers' everyday ability to perform their mission. Family support gives through the military and community services, educational and outreach if you have a family member that's on an IEP, school and early intervention services. They look at all these things to see if they're available in the area. Local transition support and non-clinical case management. You enroll in the Exceptional Family Member. You can do it through your SFA. They can help you with the forms. Or you can fill out a DD Form 2792 for medical exceptional family members, and for special education or early intervention, it's a DD Form 2791. And once again, your SFA can help you with those forms because they have to be filled out correctly, or the regional director will not take those forms and enroll you in the program. And as of August of last year, a new form came out, and several people still get a hold of the old form, and it causes issues. How did my slides get out of order here? Under the Extended Care Health Option Program, ECHO provides supplemental services to active duty family members with qualifying members who have either mental or physical disabilities. These active duty family members, mental or physical disabilities, need to be either moderate or severe. This rating is given by the EFMP coordinator's office. They annotate the EFMP summary with this severity. Serious physical disabilities, serious disqualifying or serious qualifying psychological conditions such as autism spectrum disorder. A condition causing the beneficiary to be homebound, diagnosis of a neuromuscular developmental condition in an infant or a toddler, and multiple disabilities affecting separate body systems. Let's see if I can get back to my slide here. I don't know where that came from. They were out of order. ECHO is available to the following beneficiaries with qualifying conditions. Active duty family members, including family members of National Guard or Army Reserve ordered to active duty for more than 30 days, family members eligible for continued medical benefits through the transition program, victims of physical or emotional abuse, and transitional survivors. In certain circumstances, ECHO can be extended to family members that are up to 23 years of age, and the sponsor is providing full up to 50% of their support. The sponsor must remain on active duty for this family member to remain eligible. The benefits of the ECHO program are assistive services, durable medical equipment, such as walkers, wheelchairs, that sort of thing, ECHO home health care, rehabilitative services, respite care, and training to use special education and assistive technology devices, institutional care, or transportation on limited circumstances. To register for the ECHO program, proof of enrollment in the EFMP program, and the best form of proof is your EFMP summary, which may be provided by your EFMP coordinator's office. Your regional contractor updates DEERS stating that you are ECHO eligible. ECHO eligibility is non-appealable. If it is determined that you are non-ECHO eligible, you cannot appeal that to anyone higher for eligibility. Eligible family members may be granted 90 days of provisional coverage while the registration is in the process. It can take up to 120 days. The requirement for EFMP enrollment is waived for family members of the Guard or Reserve that are called to active duty for 30 days or more, because it takes well over 30 days to get enrolled in the program. ECHO benefits may be limited to some overseas locations, not including Hawaii and Alaska. There is a cost share with the ECHO program, and here's a chart of those expenses. E1 through E5 is $25, E6 and above is $30, and E7 through O1 is $35. This is one cost share per family, not per EFMP members. I have had families with multiple EFMP members enrolled in the ECHO program, and it's not $35 per member, it's per family. And you only pay the cost share when you use the program. In the months that you get durable equipment, or in the months that you get supplements, that sort of thing, those are the only months that you pay the cost share. This benefit entitles you to up to $36,000 per year, not including the home health care benefit or the respite care. the ECHO option does. So for durable medical equipment, hospital beds, wheelchairs, walkers, that sort of thing, $36,000 a year. This does not apply towards the catastrophic cap that's out there. Getting care under the ECHO program can be difficult in geographically dispersed areas. The providers can be limited. The military installations under the ACS program, they have an ECHO program manager, and they attempt to provide providers in every area, but there's always going to be areas added. So they recommend that you use public funds and local facilities first. Always obtain prior authorization before getting any services that Tricare may have to pay for. Follow the rules of your Tricare program. If you fall under Tricare Standard, you can go to any facility you want, but you're going to pay your percentage, 20%. If you go Tricare Prime, you must have a referral to that facility. Use only Tricare authorized providers. In other words, Tricare network providers. This reduces the cost to yourself and to Tricare. Coordinate benefits before you move. This is where the EFMP program comes in as well. But the ECHO benefits that you may receive, you may want to contact your State Department of Social Health Services and state disabilities programs to help you coordinate some of those cares. ECHO Home Health Care provides skilled home nursing care, physical therapy, occupational therapy, speech therapy, medical social services, medical supplies, and respite care for caregivers. It does require services specified by your PCM or an attending physician. There is a coverage cap, maximum amount Tricare would pay per fiscal year if the beneficiary were to be in a skilled nursing facility. This brings us to ECHO respite care. ECHO respite care is respite care for ECHO enrolled beneficiaries up to 16 hours per month, and basically it's to give their caregiver or the provider, whether if it's a child, maybe the spouse is with them all the time, it's to give them a break. It's not to give them a break so they can go work. It's to give them a break to go to the movies. It's to give them a break to go grocery shopping, to go to the spa, to do whatever they want to do for up to 16 hours, to give them a break from providing care. ECHO respite care is not available to beneficiaries using the ECHO Home Health Care or the ECHO Home Health Care Respite Program. Two different programs, two different benefits. And at this time, that concludes my briefing for the Tricare Prime Remote, Tricare Standard, and Tricare Prime Remote for active duty service family members, the EFMP program, and ECHO programs. If you have any questions in anything that I've covered during today's briefing, I would recommend that you contact your battalion SFA. And if you do not have one, contact the 6th Recruiting Brigade Soldier and Family Assistance Program Manager, Mr. David Kish. His phone number is 702-639-2010. Thank you for your time, and I hope it was a beneficial briefing.